These are classified as with increased fragility and without increased fragility. The disorders with increased fragility can be remembered as whenever we see tricho paired with rhexis. Rhexis means to rupture. So trichorhexis nodosa or invaginata, these two. Or if we see twisted torti, pili torti, or if we see bubble hair, which means that the hair has a bubble, or we see trichodystrophy, thiodystrophy, and monilithrix means a necklace, which means at the constriction there will be increased fragility. The disorders without increased fragility can be remembered as woolly pili are uncombable and loose. So woolly hair, pili annulati, uncombable hair syndrome, and loose anagen syndrome. Moving on to the individual disorders, monilithrix means necklace or beaded, and we have to remember the word necklace cur. So it has keratotic papules over the scalp. It also has those papules over the nape of neck. It has koilonychia and it affects all the hairs. So we see these constrictions and the internodes along with the elliptical nodes. These abnormal constrictions are regularly arranged and we see these keratotic papules. So keratin curve is mutated and we have to remember that type 2 keratins which are basic uh, and these are in the range of 80s. So 81, 83 and 86 are affected. These are basic. So 2 raised to power 3 is in the line of 80s. We remember type 1 keratins or A by 1, 2, 3, 30s line of 30s. So KRT 30s. Then moving on to the next fragility disorder, which is trichorhexis invaginata. It invaginates like a bamboo. So this is a bamboo and we have a sprinkle net over the bamboo. So we remember the gene SPINK5 on the chromosome 5. Net means it is related to Netherton syndrome, and pathognomonic triad of Netherton is ABC, which is atopic diathesis, so patient will have erythroderma, B bamboo type of hair, brittle hair, and C is Ichthysis linearis circumflexa, which are these double-edged scale C. This is like a golf tee appearance, or the proximal shaft will invaginate into the distal shaft. So ball and cup appearance or golf tee sign. This is seen after a fracture. The treatment involves emollients, topical calcineurin inhibitors, and to avoid corticosteroids. And in this, if we think about the pathogenesis, it means that there is no LEKT1, which means that there will be uncontrolled proteases or kallikrein, which will lead to desquamation. Next is pili torti. So torti means twisted, and it is twisted at 180 degrees, and we have to remember that men and brown bear are cranky. So these are the syndromic associations. So first is menky, kinky, steely hair disease. They need ATP. So copper is not absorbed from the intestine. So copper increases in GIT and in kidneys, and it decreases in the brain, causing hypothalamic imbalance, hypotension, decreases in the skin, hair, and also decreases in the bone. Uh, Next is men and bear. So N is it is related to Netherton. B bear is Basex. So it is related to BCCs with follicular atrophoderma. Bear is Bjornstad syndrome. These two syndromes, cranky, Crandall syndrome and Bjornstad syndrome, these are associated with deafness. And the gene in Bjornstad is BCS, which means Bjornstad causes SNHL, and Crandall syndrome, cranky, so gonads are also affected along with SNHL. Moving on to Trichorexis nodosa. So this will have node formation and it is a brittle hair disease. Here we see that it is most common hair shaft abnormality and man takes two nodes. So these are the two nodes and this will be enthrusted like a two paint brushes or broomstick fracture. It can be acquired or congenital. Acquired is only distal and due to trauma, and congenital autosomal recessive, it involves all hair including scalp and body hair, and it is both proximal and distal fracture. Syndromic associations like man takes two nodes include Menkes disease, arginosuccinic aciduria, Netherton trichothiodystrophy, trichohepatoenteric syndrome, and nodes to anchor it to Trichorexis nodosa. Now, trichotheodystrophy. Theo means sulfur, so it is sulfur deficient dystrophies. Dystrophic means deficiencies. And TTD means tiger tail appearance on the alternate light dark bands on polarized light. And it has this mnemonic which is PBIDS. So photosensitivity, which means that it is related to some DNA repair disorder. So photosensitivity, ichthyosis, brittle hair, intellectual impairment, decreased fertility and short stature. And photosensitivity means nucleotide excision repair gene mutations are involved, which is ECCR. Next disorder is bubble hair. So it is due to heat acquired disorder, and on microscopy we see these bubbles, and it is uh, recommended to avoid this excessive heat. Now we move on to disorders without increased fragility. So first is annulati, which is shiny ringed hair, incidental finding in a blonde girl. So it is autosomal dominant, spangled appearance is seen, which is shiny, and it is ringed, and we see this due to multiple air filled cavities. So these bright bands and dark bands are seen, and these appear dark on transmitted light, so ulta happens. And this is just a cosmetic concern, incidental finding only seen in blonde hair, and treatment is reassurance. Then woolly hair. Woolly hair can either be localized, which is localized woolly hair nevus, which is sporadic as seen here, or it can even be generalized, which can either be autosomal dominant or autosomal recessive woolly hair. Uh, and these mutations involve keratin or LIPH. Then important is that 180-degree longitudinal twisting occurs in this, and we have to remember the associated syndromes, which includes Naxos, which Naxos is associated with no parking to the right. So we have to remember that the right ventricle is involved. Parking means plecoglobin gene is affected to the chromosome 17. Naxos and Kajawal are the cardiocutaneous syndromes which are affected in case of woolly hair. So both are characterized by woolly hair, but we have to differentiate on the basis of the gene affected, the chromosome affected, and the affected defect in the heart. Now C is like 6, so chromosome 6, and because C is an open letter, dilated cardiomyopathy happens, and along with that the desmoplakin mutation is there. Then there are associated syndromes of curly hair, which are toddlers can't comb their curls. So toddler is trichodento-osseous syndrome, can't is Chand syndrome, which is acronym for curly hair, ankyloblepharon and nail dysplasia. Comb is Costello syndrome, which has sparse hair with cutis laxa, and curls is cardiofaciocutaneous syndromes. Next is the uncombable hair syndrome, which is also known as pileal triangulati. So triangular cross section at canaliculi, it has some canal, and the hair will be seen like silvery blonde dry frizzy hair, but it often spontaneously improves at puberty, and it is mostly autosomal recessive disorder. And we have to remember the gene by pad hair day, which means uncombable hair. So pad I3 gene is involved. Next is the loose anagen syndrome. So here we see that hair is easily and painlessly pulled from the scalp. This is due to deficient inner root sheath and loose anagen hair. They can come out easily, resembling this mouse tail. And typically it is seen in blonde girls, and we see that there is this split which is there in the hair shaft inner and outer root sheath. It also usually improves it.